From CBS 4, this is Haystack TV, powered by HaystackColorado.com. Finding reliable services can be like finding a needle in a haystack. With HaystackColorado.com, finding the needle just got a lot easier. Now, the host of Haystack TV, Chris Kane.
Welcome to this Haystack TV Spotlight. If you've tried everything, but you still can't get rid of your back, shoulder, or neck pain, Dr. Paul Burns of the Spine Center can help. He's an expert at spinal decompression and manipulation under anesthesia. Dr. Burns has 28 years experience. He is board certified in chiropractic, sports medicine, and manipulation under anesthesia, and the Spine Center is a BBB accredited business with an A+ rating. Dr. Paul Burns of the Spine Center joins us today. Thank you for being here.
Well, thank you for having me, Chris.
Well, why don't you tell us exactly what spinal decompression is?
Well, spinal decompression is a way to provide relief to people with chronic neck or back pain by generally reducing the pressure within the spinal discs. The bones of the spine are slowly and methodically separated using a state-of-the-art spinal decompression unit. And as the vertebrae are separated, the pressure is slowly reduced within the disc and a vacuum is formed. This vacuum essentially pulls fluid back into the disc, restoring disc height and taking the pressure off the spinal nerves.
That's a great explanation. Now, is anyone a candidate for spinal decompression?
Well, no. Not everyone would be a candidate for spinal decompression. However, it's a very effective way of treating patients that have herniated discs, bulging discs, facet syndromes, degenerative discs, headaches, radiating neck and back pain, sciatica. Those are all major problems for people that cause a lot of pains. Talk about some of the benefits then. Well, the benefit to spinal decompression is obvious. It's a non-surgical treatment.
That's a great point. Mm-hmm.
So we have now got a way to treat people without surgery that effectively eliminates their pain in the back and can essentially just give them their lives back.
Yeah, whenever you can avoid surgery, that's always recommended. And this, you've had great success with spinal decompression. I know a lot of people that have personally done it and are walking around with, pain-free. Now talk about it's safe. It's got to be safe, right? You don't have to go through surgery.
No, well, the treatment itself is very safe. Mm-hmm. It's computer controlled. The protocols are set by the physician and set to each individual patient.
So yeah, and again, I always say if you can avoid surgery, you've got to do that. Now let's talk about something that I find extremely interesting, this manipulation under anesthesia. Okay. Who's a candidate for that?
Well, basically it's the same type of candidates.
Okay.
Manipulation under anesthesia essentially utilizes a series of gentle spinal manipulations and stretches to break up scar tissue and adhesion formation around the spine and other joints. So candidates would be the same candidates we have for spinal decompression. People with chronic back issues, frozen shoulders, problems with their knees, their ankles, virtually any back condition. And what we're trying to do here is simply break up the scar tissue that is interfering with the spine's ability to move.
And so when you break that up, it then allows you to go and do more traditional type treatments to then start their healing process.
Correct. What we do is we take patients into either hospital or ambulatory surgery center and put them under twilight sedation. It's just a mild sedation that allows the paraspinal musculature to relax. Once we have that, we're able to go in and perform the manipulation, break up the scar tissue. And until we break up that scar tissue, a lot of these back conditions and other joint issues are never going to resolve. Most of the patients have already had physical therapy, chiropractic, maybe even surgery or epidural steroid injections. And the reason those things failed was that none of those addressed the fibrous adhesions or scar tissue that's causing the problem in the first place.
Great. Well, these are all great explanations, and anyone that's in pain, I recommend they give you a call. I know you can help them. I'm going to tell them how they can get a hold of you and take advantage of an incredible offer that you have. If you've tried everyone else and still suffer from back, neck, or shoulder pain, you'll want to contact Dr. Paul Burns. His practice is located in the Denver Tech Center. Call the Spine Center at 303-694-9759 or visit their website, drpaulburns.com. Mention Haystack and receive a free, no-obligation consultation. And additionally, the first 15 callers right now that are appropriate candidates will get 60% off the price of spinal decompression therapy. The number again is 303-694-9759. The Spine Center paid for this segment.